Hi, my name is Amanda Masters. I am currently in the Applied Behavior Analyst program at Tennessee Tech, and I am enrolled to get my master's. Do you have any questions for me?
What is applied behavior analysis?
So, applied behavior analysis is an evidence-based approach that focuses on analyzing behavior to produce meaningful changes in human behavior. The meaningful changes behavior analysts are able to make with children or adults help them function in their environment. An ABA uses changes in a person's environment and consequences to produce practical and significant changes in behavior.
Oh, what kind of training do you have to be a behavior analyst?
Behavior analysts undergo extensive schooling and training. In the state of Tennessee, a master's is required to be a behavior analyst. Behavior analysts also must complete many hours of supervision and in the field. An ABA is based on the fact that a person's behavior is determined by past and current environmental events, as well as psychological variables. Behavior analysts are able to work in multiple settings. Some examples include classrooms, hospitals, residential treatment programs, homes, clinical settings, and much more.
So, if my child couldn't make it to therapy, could you come to us?
We would try to. Behavior analysts are trained to be flexible, and they try their best to work with each client's schedule and situation. Behavior analysts are mostly known for providing behavior therapy for children with ASD or autism spectrum disorder. For example, a child with ASD may have trouble with their diet. They may be a super picky eater and they're not getting the nutrients their body needs. An applied behavior analyst can use evidence-based practices to help broaden a person's food intake or their diet.
So, how could a behavior analyst do that, help broaden a child's food intake?
First, the analyst would have to figure out why the child was being such a picky eater, or whatever the case may be, and then provide intervention from there. Each case is going to be unique. This is just one example, but a child may be throwing a fit at dinner, and then the parent excuses him or her from dinner. They just escaped or got out of what the parent wanted them to do, which was eat dinner. So that behavior is going to be reinforced in the future because the child knows that, oh, I can cry and pitch a fit and get my way and not have to sit and eat dinner. Right. Children can also be positively reinforced for eating what you want them to. A few more examples of common issues that behavior analysts help families and clients with is inappropriate attention-seeking behavior, self-injurious behavior, escape-maintained behavior, toilet training, aggressive behavior, social skills training, communication training, and much more.
That's some really good information. How exactly would you help a child with their social skills?
So there are many evidence-based interventions that you can use to help clients or adults with their social skills. One example of a strategy that you could use to help children with their social skills is peer-mediated intervention. This is where another child is leading the instruction of those social skills. The important thing to remember with peer-mediated intervention is that the child providing the intervention must be instructed kind of how to facilitate that intervention. And the first step for any behavior analyst is to find the reason behind the person's inappropriate behavior. This is also called the function of the behavior. This can come in the form of seeking attention, wanting a tangible, escaping from a task, or automatic reinforcement. And when I say automatic reinforcement, this is where it's kind of like a self-soothing behavior. Whatever they're doing just is automatically giving them reinforcement. Behavior analysts help clients with a multitude of problems by only using evidence-based interventions, such as positive and negative reinforcement. Another example of an evidence-based intervention analysts use is functional communication training. This is just one example of a type of training that many analysts use with clients who are engaging in aggressive behaviors. So oftentimes when clients are taught a successful way to communicate their needs and wants with other people, the aggressiveness may decrease.
What's a strategy that can be used to help children communicate?
A common form of functional communication training is called the PEC system. This is a book of pictures that the child is taught to look through and pick out what they need and then show it to you. So for example, if the child is thirsty, they may open their book and point to the picture of a drink or water and then give it to you so you know that they want something to drink. Same thing if you're hungry or you want an iPad, just whatever they want or need, they're going to pick out that picture and hand it to you. Whatever the issue, though, with the client may be, it is important to have everyone in the child's life involved and working together to ensure the child's inappropriate behaviors aren't being reinforced. A major part of ABA is working with parents and training the parents. Analysts and parents should always work together for the best interest of the client. Analysts train parents on how to implement the behavior plan. Many strategies take place between the analyst and the parent. This includes things as modeling, role-playing, feedback and coaching, and video analogies or video analysis. So there are many things that the analyst can show the parent and can train the parent on.
So what would be required by the parent in order to successfully implement ABA training?
So there are a few requirements that a parent must have in order to implement ABA. The parent must be able to implement the intervention, manage behavior, and have joint attention. They must be able to describe the reason or the rationale behind the intervention and have communication and problem-solving skills. So they need to understand how the intervention works and why they are doing the intervention and be able to implement the intervention. It is also important to get the client's teachers involved if applicable, so the child has consistency across their settings when dealing with the child or client's inappropriate behavior. And it's important to make sure that the inappropriate behavior isn't going to be reinforced. So it's important that all persons working with the child are informed of their behavior plan. Behavior therapy is also the most common intervention used with kiddos on the spectrum because it is evidence-based. It is required that the person or child is making progress in therapy. If a child is not making progress, then something has to change within the child's behavior plan, or maybe it's the consistency that the behavior plan is being implemented at home or in the clinical setting. So you have to make sure that whatever the child's behavior plan is that it's being implemented with consistency and fidelity. Behavior therapy is it is created for the best interest of the child or person. Analysts and behavior assistants are required to follow many ethical codes that ensure the health and safety of their clients. So, behavior analyst's top priority should always be the overall safety of the client. Another important factor in applied behavior analyst is insurance. So most insurance companies will pay for ABA therapy, and I'm not sure if all people or parents know that. However, documentation such as progress reports has to be submitted in order for the company to pay for the therapy.
So how exactly do I know if my insurance company will pay for ABA therapy?
Yeah, I would just call them and ask. So ask if that type of therapy is covered. They will most likely explain to you the paperwork and documentation that needs to be sent to them in order for the insurance to cover the therapy. And with all of that being said, I just want to leave you with a simple flyer. It has my name and my contact information, my cell phone number, and my email. Please feel free to contact me anytime. This just gives an overview of what ABA is and some of the key points about it. And then there's also 3 evidence-based references provided below, and that's for you to keep.
Thank you.
Do you have any questions for me or any concerns?
No. You covered a broad amount of information on ABA today, so thank you for that.
Yeah, well, thank you. It was nice talking to you. If you need anything, feel free to reach out through my email or my phone number. Thank you.